Hello and namaste. Welcome to another episode of Behind White Coats podcast. I'm Soumya, fifth year medical student from NIHS,
And I'm Prarthana and a fourth-year medical student from NIHS.
and we are your hosts for today. The year-long COVID-19 pandemic has obliged us to do most things differently. For instance, to carry out medical education online. However, with the end of the year, most medical colleges in Nepal have resumed in-person clinical postings after almost 9 months.
Exposing a number of students to hospital setting still carries a potential risk and is of concern to both students and patients. Hence, the clinical experience this year is bound to be different from what we have been used to.
Indeed, the conventional bedside teaching learning is not possible to the same extent like before, so the clinical classes are being adapted to the new normal. This is surely a new experience for all the medical students.
In today's episode, we have a wonderful group of medical students from different medical colleges who have been posted to different clinical settings. For me personally, who is going to start her posting in 2 days, I think I'm looking forward to hearing from my seniors as well as from my friend who has already started the posting, and hope this podcast will be helpful to each and every medical student out there who's going through the clinical posting in this pandemic period. So let's start with the introduction.
Hi everyone, my name is Injina Thapa and I'm currently a final year medical student at Management Medical Campus Institute of Medicine, and I hope everyone's been staying safe during these tough times. Thank you for giving me an opportunity to be a part of this podcast.
Namaste everyone. I'm Pranej Jangrana and I'm currently studying fifth year from Nepalese Army's Institute of Health Sciences. And thank you, Soumya and Pratna Bani, for inviting me to this podcast. And I hope my experiences will be of use to anyone listening.
Hi, I'm Tejas Shahi, a fifth-year medical student at Management Medical Campus. And first, I would like to thank Soumya and Pratna for inviting me to this platform. And I hope you all my experiences today.
Good afternoon. I am Vitasna Muskan, currently a third-year medical student in the BP Koirala Institute of Health Sciences. And thank you for making me a part of this podcast.
Thank you everyone for joining us. It's a pleasure to have you all. So how did the lockdown period go for you?
So I guess I'll start. So the lockdown was pretty long. I think it started from the end of March till October or November. And for most of the duration, I was, pretty much stuck at home because I needed to make sure that I was safe as well as my family was safe. So during that time, to keep fit, I tried to work out. And I could not continue that for the whole duration, but I tried. And, for emotional support, I had my parents, and I did talk to my friends through social media. And for my personal development, I did try to keep studying my textbooks. But, that wasn't always possible. So I also read some novels, and I also started to learn Japanese. Why not?
Lockdown for me was a mixed experience. We had to stay home. And in the beginning, there was a lot of anxiety, and there's also complete halt in our life from studies to everything else. But it was also a very good opportunity for us to be with our families. I don't think we're going to have that again in our lifetime. And I got to explore my hobbies again. I also started cooking. I learned photography. And I did some exercise too to lose some weight.
It was a really an emotional roller coaster for me with mixed feelings, as I have been staying away from home since I was a child. So it was really a good opportunity for me to live with my parents and explore the inner self of me and what do I want to do in my life. It also helped me to know the things in which I'm really good at, and also to explore the things that I'm interested in. But yes, with that, the college opening was really uncertain. So it was also a factor that was always there on the back of my mind.
So for me, the period kind of started out on a scary note because we were in our community health field postings, the health system management postings. So me and my group, we were stuck in Okaldunga when the lockdown started, and we kind of had no way to get home. So that was a bit of a train wreck, if we might call it. And then it just continued on a kind of an emotional roller coaster, as Vitasta Moini just said, and just a lot of soul searching, trying to see what makes me happy within the confines of my home, spending time with my family, reading, books, mostly novels, not really textbooks, and trying out new things. Where I had the opportunity to participate in a couple of podcasts during this period too. So it was overall a kind of a necessary break, but I mean unfortunate, but necessary in the sense before starting one of the toughest years of medical school for us. So I guess yeah, that kind of sums it up.
Each of us have had our individual experiences, but there was a common experience that we were going through. That is the fear of COVID-19 pandemic. But everything changes with time, and it is said that time heals. Maybe the time could turn out for the better or for the worse, but we always had at the back of the mind, like Vitasta shared, that college is going to open. So what was your feeling when college re-announced its opening, and what was the reaction of your families to this amidst the pandemic, because the pandemic has not ended yet?
When I heard that the colleges were reopening, I was really glad and excited about going back to the college and being with the patients and learning. But as the time came closer, only then it hit my head that like I started thinking, what will I wear? Do I change clothes before I come home? Do I take a bath every evening because the winter was starting? And where will I eat? And I even went in to buy PPE set and masks and face shields. And yes, my parents were very afraid too. They're more afraid than me. But like at the end, I decided to stay at the hostel so that I would not be a source of infection to my family. Yeah, it was kind of mixed experience.
Opening of the college was obviously not a good feeling for me because again I had to go away from home. But yes, at the end life must go on. So no matter what, I had to accept it positively. And my parents were kind of happy when my college reopened because I get to study and again to continue my postings as before.
I think I kind of echo what along the lines of what they just said. I mean, we needed college to start again because we're stuck in final year and we all want our degrees sooner rather than later. But then, of course, as the days came closer, just the reality of, how to continue with the postings and how to keep everyone safe, yourself, including your family, but then also learn at the same time, especially without any particular instructions from our institute or from our professors. I think that was kind of what had us confused most of the time. But then as posting started, I did decide to commute from home because everyone in my family already kind of has to travel every day for work and we kind of are exposed. So we kind of had a common consensus. And then also the hostels don't really, like suit my way of living and just how I study and everything. So I decided to commute from home all the while isolating when I come back. And then things just continued from there, I guess.
So I think earlier I said that I tried reading textbooks and well, to be completely honest, I just tried and I wasn't always consistent with it. I was just waiting for the college to reopen. And, when the news came, I guess I was excited because it was like, oh, finally I get to like study now. And I think my parents were also pretty happy because, they were sick of me just staying in my room in front of my computer, in front of my books. Even though COVID was at the back of our minds because, it's always a risk, but I was pretty excited.
Right. And the most transitioning feeling is when you actually leave your home and pack your bags for hostel or start getting ready for the college. That's the most, exciting and scary feeling that I experienced when we resumed our college. And when you guys went to the college, what did you find there? Did your expectations match the way precautions were being taken? Did you face any kind of anxiety or any kind of feeling?
There was nothing as such anxiety, but yes, we were kept in quarantine for few days in our rooms. That was as expected, but it was not that strict. We were free to move inside the hostel and meet our friends. And after so long time when we meet our friends, there are a lot of things to talk.
Super normal. I mean, it was kind of like as during pre-COVID days, we weren't really given any specific instructions. We don't really have bedside teachings in final year anyway, so split into groups of 2 or 3. I started with medicine posting. First patient interaction, I guess, was a little bit difficult because we didn't know how to communicate, but we knew that everyone who'd been kept in the wards were PCR negative. So I guess that kind of gave us a little bit of a reassurance. And then since I'd forgotten pretty much everything that I'd studied in third year with all the clinical and history taking skills, I decided just to go forward and just start, taking histories and doing clinical examinations and looking at x-rays, looking at reports. So the anxiety of failing as well as kind of trumped the anxiety of COVID, I guess.
Moving back to hostel was pretty I don't know, the experience was pretty normal, I guess. Apart from the fact that we were supposed to follow some particular guidelines, although not everyone was following it pretty strictly. But so we were supposed to go downstairs, take our food upstairs, and eat it in our room. So I guess that was pretty different. And in terms of precautions, I guess everybody is and was wearing masks, and everybody had hand sanitizers in their pockets. So everyone did actually follow that much. And in terms of anxiety, when I came to hostel, I kind of knew that we were supposed to go through the PCR testing, and I had heard it from people that the nasopharyngeal part could be pretty uncomfortable. So I guess that kind of gave me anxiety.
So, like I told you, I went to the hostel before I started my posting. And like Angela said, most of the things were normal in our hostel. We didn't have to stay in quarantine or anything. But we did and still do keep our masks on, except when we are with our roommates. Even with all the precautions that we take at the hospital and the other areas, the biggest lapse I feel is like when we are eating, everyone takes the mask off. If somebody is infected, like they can transmit to others. In terms of anxiety, leaving home was more anxious and bitter experience for me than COVID itself.
For some of us whose posting has already started, we are in a kind of stable phase now, moved from our homes or decided what to do after we get home and then continuing our clinical study. But since all of you have been already exposed to clinical setting, how do you compare the feeling that you had at the start of the posting and now, once you've completed one or few postings or maybe continuing postings as well?
I think I've just become a lot more comfortable, interacting with patients throughout medicine postings. I've finished my medicine postings and I've moved on to surgery postings. As I said, we do have to kind of continue on with, engaging ourselves with the clinical experience. So now we do still keep our masks on and we tell the patients and the visitors to keep their masks on. We sanitize after visiting every bed. We sanitize our steps and everything. But as they just already mentioned, we have become a little bit more lax while interacting with our peers. So before I used to just stay in the library or, in my hostel room and just eat by myself or just study and try to isolate. But then now it's just kind of become impossible to just stay isolated all the time because, everyone's together in the library. Sometimes it's really difficult to breathe with two masks on, with a face shield and everything. So yeah, I think the patient interaction is still the same, still keeping, distant and being careful, but the peer interaction has become a bit more lax and a bit more comfortable.
So I'm actually done with 1 week of pediatrics and 1 week of obs gynae posting. This time around, they're kind of rotating every subject after a week. So it's a bit new for us. So as I said before, I was pretty excited, I guess, for the college to reopen. And after 2 weeks of clinical posting in the college itself, we're not my group. We weren't allowed to go to the hospital. So we were taught everything in our lecture halls, and I guess after 2 weeks it kind of grows old pretty quickly. Yeah, my excitement's pretty much down to baseline currently.
The postings have been really fun actually for me. I've been in the minor postings right now. That means like I have new departments every 15 days. I was in the ER first, then in the pediatric department. Now I'm in anesthesia department. So it has been really fun, and emergency department was the most fun I've ever had in my 5 years of medicine. Yeah, the fear is always there. It has decreased because like taking precautions has come like a second habit to us, second nature to us. But like I still remember the first day, while I was taking the blood pressure of a patient, the patient coughed right at my face. Thankfully, I was wearing a face shield, and she turned out to be COVID positive like after the next day. Yeah, it's always scary because in the ER, the patients who are there are not tested for COVID, and it's been scary, but it's also the fear has come down because like we are already taking so much precautions.
Honestly speaking, for me, I don't have any such kind of fear or nervousness in the clinical settings. It's almost the same as before regarding the way I feel. But yes, now we have a hectic schedule of 2 postings in a day because of the shortage of time, and we have to complete our course in the remaining time duration. And before we only used to have only 1 posting in a day. That was pretty much convenient and much easier to cope up with our studies and also the course. But now, yes, it's a bit hectic. Others like in the clinical settings, it's almost the same as before.
So they just had a really horrific experience in the ER. The posting are obviously being adapted to the new normal. How do you guys feel that? How is the posting different from what it used to be before the pandemic?
Oh, it is vastly different because before we used to go to a hospital every day. Now it's completely different. I mean, at least for me, I know that other groups have gone to the hospital, but for both of my weeks, we were like required to go to the lecture hall right in our study complex, and yeah, so I mean that's a far cry from being able to examine on patients themselves. Right now, the teachers they come to the lecture halls, they teach us about the examinations and theory and everything by mouth. And I mean, we do have demonstrations on dummies. And I guess those are pretty useful because I guess it's always better to practice on dummies than to like make tons of mistakes on patients themselves. You know, not going to hospital, examining on dummies. That's pretty different from what we were used to before.
The difference between before pandemic and after pandemic, I think Angela would have felt it better because she was at the medicine department and now in surgery department. Like I've been in ER and anesthesia and pediatrics, two of which were like new. But there used to be academic morning conferences in the ER, which was stopped because of COVID, and also there has been less patient load in our ER and the hospital. Decreased our exposure to different cases that we used to have.
Obviously, there are a lot of differences in each and every aspects, as we have to see faces wearing masks, which may be double or triple sometimes, face shields, sanitizers in everyone's pocket, etc. But also, we are rarely taken in bedside for in our postings. It is pretty much avoided. Though we take history twice a week, the examinations are also being taught in dummies. And few in patients also that are okay but not as effective as learning in the bedside in the patient.
For us, I think main difference was, as they just said, the morning conferences don't happen. It used to be said that like the morning conferences in medicine used to help you a lot while you were studying different topics because they were discussed extensively with the faculty, the residents, and the DMs. But now we don't have those anymore. So I think that was something that we missed out on. But then, of course, having all the other things kind of going on as usual. So we do get to go on the bedside. Some faculties, if in IOM, we kind of have to arrange the classes and everything ourselves. So that part's still the same. So we're always just running around trying to get one faculty to take our class one day and just someone else to listen to just history and discuss a case with us. During that time, they do come to the bedside and we do get to still see interesting cases. And they just said the patient load is decreased, but that was kind of the case in medicine. But I think now that a month has passed, the load is increasing again. The OPD schedule has kind of gone back to normal. And yesterday when I had my night duty in the ER, not yesterday, the day before yesterday, there were a lot of patients. So I think things are kind of coming back to pre-COVID days.
For me, who has not started the posting, it's already pretty different because I was in 5 days of quarantine here in the hostel, and with the college uniform dropped out, now we have our scrub. We'll be taking lectures in the auditorium, only anticipating what is to come and what is to happen. It's still uncertain. And we also need to take necessary precaution. We know that it is very important for infection prevention, but how much are we ourselves complying to it? Because personally, for me, I was very much scared when I moved into the hostel the first day, but then the face shield dropped off and probably one or two masks dropped off, and I'm pretty much comfortable moving around without mask inside the hostel as well. So has it been the same for all of you, or has it been different? Like, how much are we complying to the infection prevention guidelines that is required for COVID?
I think there's an ideal and there's the current situation, and in the ER department, it was really hard to maintain that. But the department had done a great job in trying their best to do so. The department gave us PPEs and full body gowns. There was a separate donning area and ducking area. Masks, double masks, and face shields were made compulsory. We did try to minimize the in touching the patient, being at the side of the patient to minimum. The department also did, PCR tests for every patient who needed to stay overnight or be admitted, and those who were tested positive were sent to a separate ER, COVID ER, or there was a COVID ward. And even so, there were some lags, like all the patients were kept in the same room, till the PCR came back. So even if somebody had PCR, like they could have spread the, virus to other people. And sometimes the crowd and social distancing was not maintaining those were not possible, because sometimes the ER would be so full, there were like 2 or 3 patients in the same bed. The other thing is the sanitizer and gloves ran out pretty quickly. So we had to use our own, and like it was really difficult, get through inside the gown and take the sanitizers outside. So yeah, we did try to maintain the standards and precautions like as much as we could.
Actually, yes, most of the things, or we can say precautionary methods, are taken by the hospital to prevent the spread. But there were certain things that I didn't like. We were kept in quarantine with our roommates. That should not have been done. We should be made into smaller groups in our clinical postings. That is also not being done. Otherwise, we are wearing masks in hostels and also in our clinical postings. Also, we are requested to wear face shields. Personal protective equipments are also obviously not provided by the hospital. That should also be provided.
Yeah, I think like the double masks have kind of become like our a protective, shield. And of course the face shield. I'm actually not a very big fan of face shields, so I often find myself not wearing them because it's so difficult to communicate, especially being someone who needs to talk a lot and ask a lot of questions. I think there's a lot of personal preferences and personal habits that kind of sometimes get in the way, especially when I find myself sitting in the library after, I've just having attended rounds or having a bedside. It's sometimes very difficult to, keep both the masks on. So I find myself switching to like a thinner surgical mask in comparison to the N95. The sanitizing, of course, and sanitizing not just your hands, but your stethoscope and any other instruments that you've used while examining. That's I guess kind of the necessary precautions that we've been taking. And I think for us, especially in my medical campus in teaching hospital, something that kind of gives me a little bit of anxiety are the visitors, not the patients, but like the patient party. So especially in the ER or in the wards, you just see so many of them, and sometimes you just want to like get it like drilled within their head that like it's just one visitor is enough. You don't have to have like 5 per bed. So that's something that kind of I think that the hospital's just not been able to control or take care of, and it's kind of understandable on behalf of the administration, but also frustrating, I guess, a little bit.
So, I mean, since most of our classes are being held in our lecture rooms, our lecture halls, I mean, PPE for us, it shouldn't be as, I guess, advanced as it should have been if we were in hospital. So I guess for us, distancing itself is a pretty important factor, and well, it's being done pretty effectively, I guess, because spacing is not that hard to accomplish in a lecture hall, and we do wear a mask. I myself, I try to wear KN95s as far as possible, and when I'm not in class, I just use surgical masks. And the college also gave us hand sanitizers, so I guess we use that whenever we examine on the dummy, or whenever we touch any surface, I guess. Even desks, yeah. And I guess most of us, we are following that much. And since from next week, I think we are supposed to go to the hospital, I guess we will be required to wear the face shield as well.
So, okay, wherever we are, whether in the hospital or colleges, we are being exposed to, a large group of people those who are in the hostel, and a large group of sick patients who are in the hospital. So there is always a fear that we might be infected, or if not, we might just be a carrier to someone else. And so do you guys get to visit your home and your close ones? And if you do, is there any concerns regarding it, and how do you address them?
Actually, I don't really get to visit my home frequently, but yes, in the near future, whenever I'll go home, I'll be a bit worried about the fact that I just hope I don't transmit infection to my parents. And yes, precautions will obviously be taken by me to prevent the spread.
So as I've already mentioned, I do commute from home, but I'm usually just in my room studying the few hours that I am at home, because I find myself returning late and heading out early. The first couple of weeks were spent in isolation, but then my parents kind of started saying that they don't really, they're not as concerned as I am about me transmitting the infections. And I guess I'm just kind of right now in a state of ignorant bliss because I've been posted in the wards where patients are already PCR negative and we assume that their visitors or their patient party or their family members are also negative, and I haven't come across like an experience of anyone that I've interacted becoming positive. So I think I'm just kind of waiting for that first impetus, and then after that I might be taking the same precautions that Tejas has already taken, shifting to the hostel or staying isolated. But for as of right now, I'm just, kind of trying to maintain distance, but not really as scared as I thought I would be.
Well, we are pretty much required to stay in hostel for the remainder of posting, which should be like 3 months more. So we are just not allowed to go home at all. We can, but we need permission from the hostel warden, and that can be a hassle. So most of us, we are just planning to stay in hostel for 3 months. So I mean, when that's the case, there's not much fear of just there's no fear of transmitting it to your parents when you don't even meet them. But sometimes they do come visit me and get me some food, get me clothes, and take back clothes to wash. So during that time, I mean, we are in contact, but it's like so brief that I guess there's just no fear. And even after contact, we just use sanitizer, we wash our hands. So yeah, not much fear because we are supposed to stay in hostel for 3 more months. After that, maybe I'll isolate myself for 2 weeks.
So during the whole ER posting and a week after, I did not go home, didn't go anywhere, and I only went after. And whenever I go home, I come home only on weekends, and I have a separate pair of clothes just to come from home to college and college to home, so that I do not like wear those clothes to my home. Yeah, and even at home, I always wear masks. I take bath before I do anything or touch anything else. Then I change to my home clothes. I try my best not to be a source, but still. Sometimes if I have been exposed to some patients, I try not coming home during that week.
It was very, very scary to hear about Tejas Dada's experience. And has there been any unexpected outcomes in the clinical posting groups which you have been posted to? Has any of you been infected with COVID before or after coming to the hospital, or any of your friends that you know of?
That would be a no for me. So during postings that I know of, I haven't been infected, I think, and I don't think anyone that I've come in contact with has been infected. That I know of.
Yeah, it's a no for me as well. Thankfully, yet neither me or my classmates, or any of my classmates for the matter, have been infected. I'm really thankful for that, and we will keep on trying our best to, take necessary precautions so that none of us do get infected in the future as well.
I, for one, have already been infected. Out of 7 members in my subgroup, 3 of us are already infected. But thankfully, nobody got sick or got infected during the postings, at least not so far. So we still do take precautions. Even if I'm infected, there are always chances of reinfection. There are case reports, so we still take precautions.
Honestly, standard precautions were taken in the hospital, and most of our classmates, including me, were taking standard precautions even by ourselves. So it didn't affected much in our setting, and as far as I know, no one is affected in our batch up to date, and I just hope that no one gets infected in the near future as well.
Okay, in this lockdown period, we got to experience so many different modalities of learning, like online classes, skill labs, webinars, and class recordings. Do you guys feel that we should permanently adapt to any one of these methods after the pandemic is over?
I guess I can speak for everyone here that online classes were pretty much new to everyone. It was like really different just being in front of your device and I don't know, I guess staring at your screen. Now, whether it was effective or not, I guess it depends on the individual. For me personally, I prefer lectures in person because I just cannot concentrate if the classes are online because, I can be distracted by anything in my room. So it's better to be, I think I prefer to be in a lecture hall. But, when it comes to adapting it after COVID, I guess online lectures could be useful in case a professor is not able to attend to the university, and in such cases maybe they can take classes from wherever they are. And another interesting thing was practicing on dummies. It was definitely a first for us. I guess practicing on dummies could be mandatory, like because examining a dummy is like much easier than doing it on a real patient. So that could be a first experience, and then students can move on to real patients.
So as a theory class session, I think online classes are very good. They save a lot of time, and it can even be recorded and we can watch it later and in double speed if you want. So, and also it's safer during these COVID times because we have 75 students in a pretty small lecture hall. But in terms of clinical sessions, clinical classes and exposure, I think nothing is better than going to the hospitals and or having case discussions with our faculty in a small group. I mean, that's what's going to develop our clinical skills, and I think that's very important. We haven't have any skill lab sessions, so I think it is important. We should do it.
Yes, it's a bit convenient to learn classes online, but in our college, the classes in the lecture theater were called as SIS, that stands for Structured Interactive Sessions rather than lectures, which was not possible in online classes. So, in our honest opinion, conventional learning methods were better, and I would prefer to continue them in the future rather than online modalities.
For me, I think we didn't really get to experience as many online classes as, say, maybe our juniors did because we don't really have that much theory classes during final year. I didn't really mind them because I like online classes better than in-person classes. I often find myself giving in-person classes. So for me, it was kind of convenient to attend lectures from the comfort of my home. We didn't get to go to the skill labs and we still haven't. So I don't really have that much experience with that. But I think that for people like me who like online classes better, and especially in settings such as our institute, where we often find the faculties being unable to take the lectures in the scheduled times because of their busy clinical schedules, I think the online option is a good one because I think that I've heard, I've listened to my juniors saying that they sometimes have classes during like 5:30 or 8 p.m. So even though the timing is a bit unusual, the classes still do instead of just kind of being pushed to later days because of this option. So I do think that it should be continued and it should be kept available as an option during the future.
I do personally echo what Angela Didju just said because online is much more convenient and much more personalized rather than the in-person lectures. And everyone was quite uncertain about the resuming of clinical posting. But in your opinion, do you think that resuming the clinical posting was a decision that needed to be taken as of now, even though we are at a pandemic and a new coronavirus strain is being talked about? So was it the right decision? What are your opinions?
In my opinion, it was, I think, the right decision. And it was time they started the postings, at least for final year students, because we mostly have only clinical posting, except for a few online classes. We didn't have much academic activity. And I think as a medical student, we should be prepared to keep ourselves in these kind of position. This is what we do. This is what we are going to do. Plus, studying medicine, I think for me is only fun if we get to study something and go relate whatever like we read in the clinics. So yes, but on the other hand, I think our college should have made more arrangement for us to ensure our safety, like ensuring hostels for all the students with clinical classes, providing PPE or gowns and sanitizers, because we have to use our personal sanitizer and it's not actually that cheap. So, and they should at least have, provided us with an orientation session before starting the posting. But it was the right decision from the university IO.
We are not sure when will the pandemic be over, and one day or the other we will have to resume our classes like before. So in my opinion, it was a nice decision to resume the clinical postings with the standard precautions that are necessary to be taken.
I think we needed clinical postings to start because especially our batch, our graduation date has just been kept, getting pushed back. And as they just rightly said that this is our job, like we've kind of committed to this profession and it's probably not going to be the first pandemic that we're going to be facing in our lifetime. So with, new mutations and new strains coming up, it's just that life has to go on with whatever precautions that we can take. So yes, I think it was the right decision to continue clinical postings.
Yeah, I echo with what everyone has already said. Our postings would have happened sooner or later. So it was the correct decision. As simple as that.
Yes, everyone, including me, I'm with you guys in this. I mean, it's our job to be prepared and to face whatever it comes in the sector of health, that we deal with it, so that we'll be able to deal with future pandemics, which is, it's not sure that this will be the only one we'll be facing. And also the fact that MBBS is already a 5.5 year course, including the internship, and every single year there are strikes and postponing of the boards. That the 5.5 year is just the minimum time required. For now, I think it will almost go to like 6 or 6.5 year for our batches. So for this, I think the clinical postings and theory classes are shortened, and the clinical exposure is also compromised. With this, I have this fear that I may not be as competent doctor as I would have been without the pandemic. How do you guys feel about this?
Actually, in our hospital, the study duration is not shortened as such, and it's the same as before. So it does not make much difference. But yes, exposure is limited and examinations cannot be done like before. So one or the other way, it is compromising our study.
Yeah, so our postings haven't decreased. So we still do have a 5-month posting duration that happened before COVID. Our postings are done on Boishak 6. So there's nothing that I have to say about the shortening of clinical postings. I think a lot of the students in my institute, our primary concern is that we're not going to get an adequate exam break. So after our postings are done, we've been hearing rumors about exams being conducted within a month at max, which is probably going to be very impossible because as I've already experienced, and as probably Tejas has already experienced, that barely get time to study during the day. And it's impossible to study medicine in a month, surgery in a month. And just the idea of just having a month of exam break is just such a joke. And I really do think that the university needs to kind of reconsider their priorities, and if they want, competent medical doctors becoming their interns who actually know the stuff that they've seen during clinical postings and get to study it, they should consider, our opinions on this. But other than that, I don't really have any concerns about the postings being decreased, I guess.
Unfortunately for us, our postings have been shortened. Usually we used to have 5 months like IOM, but currently I think we're only going to have like three weeks of posting for one subject. So that's pretty low. And so I guess, but due to the circumstances, I guess it's understandable. So we just got to hunker down and study. Nothing else to it.
Yeah, like Angela said, our postings haven't been decreased, but our main concern is that the exam leave have been shortened. I mean, it's going to be really difficult if we have to complete all of the final year subjects in a single month. But yeah, I'm not really concerned about the postings being shortened.
With the pandemic, everything is going in a fast track response. The university decided to resume on a short notice. We were posted to the clinics on a short notice. Even the posting duration has decreased for some of us. We are not getting adequate exam breaks, and there are so many problems that come with the pandemic, apart from keeping safe and not getting infected. So how are you all coping with all of these problems that you've faced, or how have you planned on coping with it?
I think for me, the biggest difficulty in transitioning was leaving the comfort of my home. As I'd already mentioned, we were in like our field postings, health system management postings, and before that we had a lengthy exam break. So it was a lot of studying and, just staying in the hospital, in the hostel, etc. So having had a 7 to 8 month break, in between, it was difficult to transition into, that go mode that you need during final year, just like wake up, eat, sleep, study, repeat, that schedule. So it's been difficult kind of trying to myself to transition into that, as well as, just there is like a low level of anxiety that just does persist throughout the day with COVID. I mean, even if I'm not thinking about it, I know that it's there. I know that it's kind of hampering, day-to-day activities to some extent. But we are I do find myself slowly getting back to, pre-COVID days of, just being that medical student that I need to be. But it does take time. And I think it's probably normal to take time. So it's not that big of a concern. Just wish that, it would happen quicker because it's final year. I mean, I think for third year students, it's totally normal to take your time to adjust, find your comfort level. But for us, we're not given, that pleasure of having that time adjustment in final year.
I think Angela pretty much summed it up quite perfectly, and I think everyone shares the same sentiment. And regarding our studies and dealing with the pandemic, I guess we'll be isolating more in our rooms. Staying isolated, so I guess we will have more time to actually study. I mean, medical education, it's not about studying all the time, but I guess the circumstances will kind of make us go there.
So it was a really big transition, from the lockdown period to, starting our final year posting. But since we are in the final year, we have a lot to cover, in terms of, topics and books and everything. Like my concentration has been completely directed at the studies, and whatever time I have, I rest, I eat. And like Angela said, we are like, wake up, eat, study, sleep, and repeat mode. So I think my coping mechanism is mainly directed at the final year, studies rather than the COVID situation. But like I have not stopped, ignoring this precautions related to COVID. It has actually come like a second nature to me, sanitizing, keeping social distancing and everything. Yeah, I think my more focus is more on the studies right now.
Yes, obviously, home was really comfortable for everything, and the schedules have been really packed and busy. But viewing the positive side, it has proved that we can really work hard when we are given to do so, and also we have already enjoyed 9 months at home, and so obviously we can dedicate few months for our studies now.
Right. It is really interesting to hear that everyone has different perspective, opinions, and experiences. Now we have almost come to the end of our episode. Lastly, I would like to ask you guys if you would like to advise other medical students listening to this podcast who haven't yet started the clinical postings so that they can make the most out of it.
If anyone's afraid, absolutely okay to be afraid, because COVID is dangerous and it has taken the world by storm. So it's perfectly normal to be afraid. But on the bright side, take the necessary precautions, and yeah, you can do well. I wish everyone a lot of luck. And yeah, thank you everyone.
So what I would like to say first is safety first. So both yours as well as the patients. But in MBBS, we go to the hospital for learning. So learning is equally important to say. Don't forget double mask, at least one N95 mask and a surgical mask outside. And you can change the surgical mask more frequently every day if it's possible. And wearing a face shield is also very helpful. And always button your clothes, use sanitizers. And in terms of patient exposure, like most patients are afraid of COVID as well. And I think what we can do is we can counsel the patient, but we need to take all the precautions for the patient as well. Also, we can, it's a good idea is to ask the patient to turn away if you are examining them, so that they do not like breathe, exhale towards you. And also what we can do is we can make the patient history taking and examination really quick. We can come prepared. And I think this will help in our final year exams as well, because we'll be given only a short amount of time, I hope. And best of luck everyone who are starting their postings.
I think he has covered most of the things, and I guess it's the same: wear double masks, use sanitizers, avoid unnecessary contact and examinations. Be prepared actually beforehand. What do you have to do, and what do you have to say? Because at the end, risk of transmission is equal from patients to us, or from us to the patients. So yes, take necessary precautions and be careful. And at the end, don't compromise your learning.
I think that everyone's kind of pretty much said everything that I probably would have said if I was the first one speaking. But I think It's just take your time. Mental health is very important during this time as well. So if you're taking a bit longer to cope to the situation and adjust than someone else maybe, then that's totally normal. We all go at our own pace and we all have our different priorities. So if you feel that safety is of your utmost concern, then make sure that you're surrounding yourself with people. Well, don't surround yourself with people during this time, but you who are, in circles where people feel the same and you all take your necessary precautions, because you can't control those around you, but you can control yourself. So remind your patients to keep their mask above their nasal bridges, and make sure that you kind of kindly request the patient party to step away or step outside when you're taking your history and doing the examinations. And just when you're counseling patients, be kind, be humble, because we're all new to this situation, and they do look up to us and they do trust our opinions and our advice probably a bit more than a layperson or someone who's non-medical. So yep, that's it. Just stay safe and keep yourself healthy, but then don't let it consume you. And thank you for this opportunity and best of luck.
For me personally, hearing from all of your experiences has made me much more confident and reduced my anxiety that I have before I start my post days. So thank you so much for coming and sharing all of your opinions. I hope it is helpful for each and everyone listening to this podcast as it was for me, and I had a fun time recording it. So thank you so much, everyone.